ACCC is 17,000 members and nearly 700 cancer programs, which makes us the leading education and advocacy organization for the entire cancer team.
Because it's the only multidisciplinary organization, we all have the same interest about healthcare policy, reimbursement, legislative advocacy.
I see one of the key roles of ACCC is their advocacy on a national level and in the policy arenas. I know they testify regularly. They ask their members to input with information that they can use in testimony and presentation. And they do a good job, I think, of calling upon the membership when in fact they can lend their comments or their support to a particular initiative.
As members, we have access to our representatives in Congress. At the state level, our representatives expect to hear from us. Our members take care of close to 60% of all cancer patients. That's very influential.
I'm excited about the pharmacoeconomics program. I want to look at the results of the program and see how we can use it to impact our practice. I'm also very excited about the financial counseling program to get information on how to implement, help with job description, help with training, and be able to go back and say, this has helped other practices.
ACCC has the basic information about putting together a survivorship program, and that's readily available. They can go online, they can click on it, they can log on.
One of the best things about ACCC is the opportunity to come to meetings, to network with my colleagues.
It really is a good educational opportunity to find out what's going on in the oncology community in your specific area and overall.
It's an opportunity to really look at the more global world of oncology, especially in today's economy and reimbursement and all of the things going on with changes in healthcare.
As a young administrator, the ability to network at national meetings is a huge resource to me. To be able to tap into the knowledge of seasoned administrators at these type meetings is a tremendous asset as a part of this membership.
And people, I find, through the organization are more than willing to share what they're doing and what they're finding and some of the best practices and decision making that's going on.
About 9 years ago, I was at an ACCC meeting, and it's the first time I ever heard the words 340B drug discount program. It was during a networking session, and somebody said to me, "Have you heard of this 340B thing? You ought to get on that." It has saved us as much as $17 million a year to be on that program, and I would never have known about it if I hadn't been just talking to my acquaintances at an ACCC meeting.
When we were starting our Cancer Program of Excellence, we utilized the Cancer Program Guidelines to make sure that we were meeting what I felt were the national requirements for a really excellent program.
ACCC has been a big contributor as far as a resource to our overall financial stability, and probably the best illustration of that was the recent publication that came out that spoke to reimbursement and patient assistance programs. And our ability to use that supplement as a resource in reviewing our own pharmaceutical program, we were able to uncover about $250,000 in savings.
If I have a question about resources, I just have to post it on the ACCC listserv. I can get all kinds of answers within just a matter of minutes. That's just so helpful.
We have sites in remote and rural locations, and how do we manage that, and who can manage that, and what are the guidelines regarding that? ACCC was key in kind of organizing it on a national basis.
Sometimes we forget that it's the smallest questions that actually has a larger impact, and the fact that the members can talk to each other by email or through the Mind Network is a great benefit.
Cancer care continues to evolve. ACCC is an invaluable tool for networking, educating, and advocating for the entire cancer team. Together, we can achieve excellence.